Hey, this is Irvin Eisenberg, and you are tuned to Resilience Radio. I'm the host of the show and owner of Resilience Occupational Therapy. As always, the opinions on this show are not necessarily shared by me. I like to feature a variety of different perspectives, and not everything resonates with everyone. Additionally, none of this is meant to be medically diagnostic or prescriptive in any way. Today's guest is speech-language pathologist Leah Sophrin. Great to have you on.
Hi, Irvin. Thank you for having me.
So, can you tell me a little bit about what led you to the work you do?
Oh, wow. A suggestion, I think. I had moved back to Vermont a long time ago and was kind of doing all sorts of random jobs. And someone kind of out of the blue said, have you thought about being a speech therapist? I think because they knew I had studied languages in the past, and I'd never heard of speech therapy before, speech language pathology. So I guess I started looking into it and decided to go down that route. Currently, though, I think what the work that I do is maybe a little different than what most people think about or know about when they think of speech language pathology. Because it's a really broad field. So most people probably think of someone who works in the schools or does like articulation therapy, which is really just working on speech with little kids. I get what I call my speech therapy confessions when we're traveling someplace or out wherever, and people are like, "Oh, you're a speech therapist. I had speech therapy when I was 5. I had to work on my R's." And it's amazing, like the number of people who like are so compelled to be like, "I had that." I find that really entertaining. But but I don't do that kind of work. I do a lot of work with adults with disabilities, specifically around social communication and interactions and like developing like skills that everybody needs for developing relationships. Um, I work with people who either don't speak or speak really minimally and use assistive technology. I do that work somewhat in the schools, and I also do that work in my own private practice. Um, Off and on, I've worked with gender diverse folks who are looking for voice skills or knowledge about how to work with their voice so that the the way their voice sounds matches their expression of their gender identity. Um, I've done some of that work one-on-one, and now I'm working with another speech therapist who's in Burlington, and we're doing that. We're offering some groups. I think we've been finding that there's different, different people have different needs, but working on that kind of thing as a group, a small group, is really powerful. Um, and then I think lately, the other main focus that I've been incorporating a lot into my work is around something you might be familiar with called interception. In speech pathology, there's a lot of focus on like people being able, it's all about the communication part. But what a lot of even speech therapists and other kinds of people who do similar work don't really always know is the skills and the experiences that are required before you can really talk about what you're feeling. You have to be able to identify it and identify an experience and be able to put language to that. So in a really simple way, that's how I introduce people to interception. But I think in a more general way, I call it sort of like a somatic element of communication. Um, so I find with all of the different people I work with, almost always there's some kind of disconnect between their awareness of what their experience is and the language that they have to describe that experience. Either they've never had an opportunity to really develop that language because of all sorts of reasons, or they have some language, but it's not serving them effectively. It's either not specific enough, or it's not it's not interpreted by others in the way that they want it to be. So in the last year or two, I think I've really started digging into what I call somatic vocabulary, especially for for people who are non-speaking and use assistive technology. The software programs that are used in that technology represent several thousands of words, but very few of those words are reflective of someone's internal experience or sensory experiences. So it's an interesting kind of I don't know area that I've sort of honed in on. I'm really interested in the areas where things overlap. And this happens to be a particular one that I find interesting. So
I want to
that's
take
kind
a
of a big picture. Yeah.
okay. Well, I want to take a step back on the interception piece for a moment and maybe explore that a little more. So my understanding of what interception is, and is that, well, we have these different sensory systems in our body. We have our auditory, we have our visual, and we have these different maps. And a lot of people know what proprioception is, which is technically where our joints are in space. So body awareness. And then interoception is a little more amorphous. It's where your organs are and what you're feeling in your organs. And for obvious reasons, we don't need to know the exact location the way we need to know where our elbow is, because so it's less maybe clear. And I'm curious, so this idea of knowing where your organs are, and well, first I'm curious if that definition jives with how you're thinking about it. And then the other question I have is, what is that experience of that organs? How does that lead to that lived experience that you want to then accurately
Right.
express?
I think that the maybe definition of interoception that I work with is even more specific. It's not just where your organs are, but what is happening that is giving some, what is the physiological experience that's happening that's generating some kind of impulse that's then being converted into an emotion, essentially, or state of being. So like if your stomach, for example, is grumbling, is that message being sent to your brain and I say converted or translated into the state of I'm hungry? And do you have the awareness of that sensation in your stomach? The awareness of like, oh, I'm thinking something that's connected to something in my body, or like I'm aware that like my thought of being hungry is connected to something in my body. And then do you have the language to pair with that once there's that like, oh, something's happening in my body, something's happening in my stomach. Oh, that is, I'm hungry. For some people, that isn't present, or it's unreliable or inconsistent, or it's present, but the language piece is not there. So that's how there's a particular occupational therapist who I've learned a lot from. Her name's Kelly Mahler, and her sole focus is interoception. And she's done a lot of great research. She's like, she loves research, which is nice that she like just shares it with people. But a lot of her research is working with neurodivergent people who experience differences in interoception from neurotypical people. And really, I don't even know. I think at the base of her work, it's really just looking at the differences across like the human experience, that there are differences in interoception and what do those look like. But one of the things I found really interesting about her work when I was introduced to it is that it is sort of like this bridge between the language part and the experience part. And that's something that a lot of folks I work with, both clients and like their families or their teams or whatever, often there's not an awareness that that bridge even exists, that there needs to be that bridge in order to understand, or rather in order to address the communication part. Like if someone isn't aware that their stomach is grumbling, and or they're aware of it but they don't have an association of it to their stomach or something like that, then asking them to say that they're hungry isn't going to make sense to them. it's gonna it's not going to be able, they're not going to have a way to contextualize it. So I think that's sort of a really concrete option or example. When I work with people who are minimally speaking or who do not speak, one of the main things that their families want or their educational teams want is for them to be able to talk about how they're feeling. And so that's where a lot of this kind of comes from, is like, we want them to tell us, how they're feeling and what they need. But if you're not connected to your body, or there's a breakdown in the message between what's happening to your body and how that's being processed, and 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 you have a language disorder, so like language is already kind of tricky, it's going to be really hard to tell someone that you're hungry or what you need based on your body experience. And if your sensory needs are different, your sensory processing is different than what people are expecting or accepting, then there's just these layers of complexity to it. So in the last couple of years, I think this is an area that I've been doing more and more, kind of exploring around, because I see the same kinds of challenges with some of the adults I work with who have developmental disabilities and who are, they are they speak, they communicate with speech, and they have these challenges too. And some of them have more language than others. Some of them have more experience talking about these things or identifying what's going on for themselves. But it's still such a significant, like an area that still really needs a lot of development.
Yeah, so this is making me think of a couple of things. And I am, as an OT, language is sort of overlaps with, but not in in the area of study that I tend to, and practice that I tend to be in. So I'm speaking as just an interested person, not necessarily as a professional in this terms. But I think of language as, we tend to think of language with the sole purpose of communication with others, because as social mammals. And it's my understanding that also language helps organize our own internal thoughts, whether or not the whole like talking to yourself to organize your thoughts. It's my understanding, and I might have this wrong, that childhood amnesia, the first few years that we don't really remember, tends to correspond with not having the language to remember it in.
Ooh, that makes sense.
I've heard of people who didn't have language as adults, and then when they developed language, it was a sign language being taught to these people who didn't have it, that suddenly they were able to, they didn't have memory, they couldn't put to words what had happened prior to that. And it was almost like they had their life leading up to language had this amnesia state that was, in some cases, decades. So I'm thinking about like your experience of your internal, being able to communicate externally is not just to be able to communicate that your stomach is rumbling and that might mean you're hungry, but it's actually like until you have the words for hunger and your stomach, and that feeling that you're not even able to sort of have that history of understanding there. Of course, it makes me think about animals that non-human animals that might not have language as we think of it, and what that means for their experience, and what might be lost in organizing our brain around language. But I feel so it's just making me think that just helping someone have the words for being hunger is not necessarily just so that they can express it to you, but for their own functional benefit.
Yeah.
Sure.
Yeah. And as you're talking, I was thinking there's something called a semantic web, which is where like you have an idea or a word, or like, let's say hungry is the word. And as we build a web of context around that word, there's all kinds of different associations that we can make. So like one association with hunger might be like around body parts. One might be around what you do in response to hunger. One might be around sensations of hunger, but then you also from there might have sensations that are similar to hunger but could also mean sick. So like you begin to build this web of association of the meaning of words and experiences, and that is like the one of the core pieces of language development. And so what you're describing is like in the absence of that, there isn't like a way to connect the things that we might be experiencing in a way that other people understand, or to share them or access words or sign or whatever the modality of communication is in a way that other people are going to understand. And what I think that's kind of how I ended up becoming interested in this topic, is that I would work with someone whose team was like, we're focusing on emotions, and that was like the center of their web. But as we started exploring like that the web that they thought existed, we found like, oh, there's like a big chunk. This web is not well constructed. It's got a lot of big holes in it, and that's contributing to this person having difficulty communicating about the things that other people think they ought to be able to communicate about. um and then when you think about like, well, what is the web made of, like what is the actual material of that web, and how well constructed is that? And to me, that's the like somatic experience that is informing this. Like it's really hard to have a concept of something you've never experienced, or a concept of something you have no background knowledge about. So that's how I kind of think of it, is like there can be pieces to the web, but if the material of the web is based on other people's experiences and not your own, it's not going to be a really well constructed web. I don't know where this now. I'm sort of extrapolating here, but that's sort of how I think of it.
Yeah, so I think of, and that's really tricky for something as personal as interoception. I can learn the difference between left and right by someone else saying that these are the rules of this is my right hand, this is my left hand. We can argue over exactly what shade of red that is, or whether it's a red or an orange. But the reality is there's an external light wavelength, and we can develop a common language around it, and might have different nuances. But I often talk about this in terms of pain. That one person's description of pain, we have so few vocabulary words that describe the physical sensations. We might have dull and throbbing and aching, but what is the difference between sharp and stabbing? Because one person might have been stabbed in a very nervy area, and that's a nervy stab feel, and another person has never actually been stabbed, but they're imagining what that feels like and the connotations behind that. So when I say stabbing, does that mean the same thing as to you? I mean, or some of my favorite ones is the difference between pain and hurt. I'm like, are you feeling any pain? No, I don't have any pain, but it sure does hurt. I'll be like, well, wait, we're dealing with different languages for your body.
Exactly. Yeah.
Yeah. So it becomes a tricky communication piece. So I'm curious, how do you as someone who, and I don't know how neurotypical you personally are, but regardless, you are neurally different. You're neurally different than many of your patients, many of your clients. How do you help them develop a language when you're not feeling what they feel?
Yeah. I think that where I start is just introducing that there is language. I don't usually try to label. I don't label other people's experiences for them, but I do label my own experiences and introduce lots of new ways and different ways to talk about those experiences. And I usually do that through really concrete kinds of activities where um, we're at least doing the same thing. So there's not a question around like if we're squeezing like a squishy ball, or if we're smelling like an essential oil, like there's something concrete and shared about that experience, so that we know we're talking about the same kind of experience at least. Whereas with pain, that is like super abstract. I try to bring it like as concrete as possible. and then talk about all the different things that I'm experiencing. And when I do this in a small group, there's enough variety in people's experiences that I think they're like just beginning with that there's developing an awareness that different people have different experiences is really important, because many of when I'm thinking of some of the adults that I work with, they've gone through a lifetime of being told to, like, these are the expectations of you in these settings. And it sometimes takes a fair amount of work to reestablish that they can have their own individual experience, especially if they're not someone who has a personality where that is already important to them. So just starting in a group and identifying, like, whoa, we're not all having the same experience. Let's just start there. And then talking about, well, what is your experience? What are some of the words you're using, or some of the words you use to describe what you're feeling, or the sensations that you're having? And really that part is probably where I spend the most time, because I think that is the biggest shift, is when someone realizes they don't have to just give the same answer as someone else. They can say they don't know. That's also a big piece of it, is like they can say, I have no idea what I'm feeling. And that is totally acceptable and really encouraged, because if they really don't know, I don't want them to make something up. I want to know that, like, there are aspects of this where it's like I'm trying to find the line in between what an OT would do, which might be more of that, like, oh, you really don't know. Okay, let's bring there's an OT that I collaborate with sometimes too. And then there's the more, like, sometimes it can go in a more like mental healthy direction too, like, oh, you have a lot that you need to process. Like, this is way beyond like pairing language with a sensate, language expansion. So finding that, like, space in between where it's really just realizing you can talk about your experience. Your experience doesn't have to be the same as other people's, and you can talk about it in all these different ways. Like, yeah.
So you're doing these in group settings, so that's not just the example of what one might be experiencing isn't just you. How big are these groups?
I've done it in groups and individually. The groups have been about 5 or 6 people.
And these are
And
adults with developmental disability
it was
challenges.
adults, and sometimes they're like another adult who is with them during the day, like support staff, or sometimes if they live with a home provider or a family member. So it was a mix, which was also really interesting, because I think it really highlighted for me how this is something that most people could really benefit from, like, expanding their vocabulary around. And also, like, um it was really interesting to see how um the people in the group who do not have a developmental disability, um how much more it helped them understand some of the things about the people who they're working with or supporting, that they previously would have attributed to, like, oh, they don't want to tell me something, or they just don't like that, or they don't understand. And I think that's one of the things I've really, I don't know. I never used to. I don't like participating in groups personally, but somehow I keep creating these group opportunities for people, and I think that it's really cool to see from, like, the sort of facilitator perspective how powerful it is for those preconceptions to kind of be broken down, and misconceptions about the people that know each other really well, how they realize, like, oh, we're making a lot of assumptions because we just don't know what we don't know. Um, and that has been really cool for me to see.
So somehow I'm thinking about a good friend who's now passed away, who was talking about who had just had some miscommunication with either a sibling or their mother or both on that day, and was just venting to me and said, the fact that two people can grow up in the same household and mean entirely different things when they say the same thing. How can anyone communicate with each other ever? I just thought it was sort of like a
yeah, it's a really good question.
So I guess that leads me to sort of taking it into the because most of the listeners might know someone who might benefit from your groups and your work, but most of the listeners are not directly in direct relationship with the way the people in your group might be. But it seems like these are this understanding of the neural variants and people's language variations and ability to express themselves is something that could benefit people in their interpersonal relationships and communication in general. Do you have any examples for yourself or for others where you feel like it's the things that you're teaching in your groups have been useful sort of in more conventional settings with?
Well, it might be the other way around. I think that part of the reason I started looking in, like, wanting to learn about these things and wanting to try groups is because of work I think I was doing individually for myself without really realizing that it was in this kind of category, and without really realizing that there were connections to, like, developing a better understanding of my sort of experience of being in my body and what that had to do with communication. And I I also think, just to get super jargony for a second, like, the relationship between interoception and language is maybe obvious, but interoception also interacts with things like executive function skills, which is like attention, or things like um, confidence or memory, or it like interfaces with a huge number of sort of the the things that are operating in the background of our everyday lives and how we function, like the things that allow us to function in everyday lives, like the background operating system is informed in part by interception. And I think for me, as I was developing a better understanding of my own sort of operating system, so to speak, um, I started making these connections um, between like, oh, when I feel this way in my body, it has a really positive effect on these other things, like communication, like my patience, me being patient with people, with my attention, with memory, with my ability to advocate for myself, for all sorts of different things. And so I found that it had a really positive effect when I work with a lot of adults. Like when I work in the schools, I am working mostly with adults who are supporting students. And I think it had, like, the more I understood about my experience of being in my body, the more um, I was able to navigate connecting with other people in ways that allowed them to just kind of be who they are, and invite them to also think about those things for themselves, which fosters a stronger connection. Even if it's in like a work setting where we're talking about, a literacy program for someone, or if it's in like, um, yeah, I don't know. I could come up with more examples, but so I think like my experience of these things came first, and then it sort of led into seeing these things connect and wanting to explore them for my clients. Um, I guess along with that, um, let's see, there's another piece of it where, like, working with voice clients, whether they're trans or not, it involves the body. Voice is about the whole body, even though we mostly think of it as like just one small part of the body. And voice isn't something that I'm like super, super knowledgeable around. I feel like it's an area that I have an interest in. And so I like dip my toe in every now and then, sometimes like my whole foot. And then I'm like, oh gosh, okay, that's complicated. Let's back. um, but every time that I do that kind of work again, I'm reminded of like, this is a very whole body experience. Um, and so I think a lot of like that kind of awareness was developing simultaneously as my own personal awareness of my kind of state of being in my body or experience being in my body. Um, I forgot what your question was, but
Oh,
you want
it
to.
was sort of personalizing it beyond just the people you're working with, which I feel like you did answer in a possibly a less interpersonal and a more personal way, which is I guess which I guess is sort of a theme in what that I'm thinking about for this is that we've got at least part of what you're talking about that I keep sort of latching onto is the idea that being able to articulate your interoceptive experience is not just so that you can communicate that to someone else. It's so you can better understand it for yourself. So it's
Yeah.
giving people words and giving them ability to fully explore them, express themselves isn't about the person they're expressing it to necessarily, though being able to say, hey, I'm hungry, or when you do that, it really bugs me. Could you stop that? Because I can't focus. But it's as much about your own lived experience and what you do with that. Being able to put a word to something is powerful.
What you were saying too, it reminded me that when I first started doing voice work, um, a couple of the people who I studied with a little bit, their background was in theater and in performance and had nothing to do with speech therapy or speech pathology or, um, this more like pathologized or medicalized kind of aspect of things. It was really about embodiment and performance. Um, and so I think that that also really influenced like my trajectory because I found that just personally way more fun and exciting and like engaging and made more sense to me than some of the like more clinical approaches I think that I had been introduced to in terms of how you think about like the voice and the mechanism that creates voice and more like the those pieces of it which felt very disembodied and kind of disconnected from the individual. um, and there's a really interesting overlap between a lot of what I learned around um, like these embodiment practices from a theater perspective and a performance perspective and interception and like somatic kind of things in general. So for me, like I have the kind of brain that connects things that sometimes don't seem connected or that seeks out the connections that are maybe not the most like immediate ones. But this made so much sense to me. And it really informed how I approached working with clients on their voice. And I think I mentioned there's another speech therapist in Burlington I'm working with who her name is Sierra Downs, and she works exclusively with voice clients, all kinds of different voice needs. And she and I are doing a vocal improv group for gender diverse people, really just exploring like the voice outside of any sort of gender binary, any sort of binary. And it's a really interesting combination of like activities and practices where you're playing with sound and you're assigning some kind of label to that, some kind of descriptor, so that you have a way of identifying it for yourself. Like, oh yeah, that's my scratchy voice, or that's my, windy voice or whatever. And it doesn't matter at all if that's what other people would describe it as, or if other people have the same voice. Like, that part is not relevant for this kind of activity. It's more about just you could give it a number if you wanted to, like, that's voice number 1. But it's really just a way to be like, here are all the different kinds of voices that I can produce, different vocal qualities that I can produce. Which ones do I like? Which ones work for me? Which ones feel good? Which ones don't feel good? And when do I use them? How do I use them? Who do I use them with? How do I how do I practice these if I want to do that? How do I switch between them if I want to do that? So it's really thinking about the voice as like this tool or instrument that can do so many different things. And it's helpful to give all those different things names. And again, that's an area where it's like, what do I call this? What exactly is happening? Like, do I care if I know what's happening, or can I just give it, a name that somehow is meaningful to me when I make that sound? And trying to get out of like so much of the logical thinking around like, well, my vocal folds are doing this when I make that sound, and so I'm going to call that like a tight voice. And just being like, because that may be what's happening, but it also may be that when you make that sound, it reminds you of something. And if it reminds you of something and that's going to stick and help you be able to recreate that voice again, then call it that thing that reminds you of. So that's sometimes hard for people. That sort of like combining, improv in general, I think, is a little tricky when it comes to things that are very sensitive, like, and personal and related to identity. So trying to bring some I don't really like calling it flexibility. I think it's more about like expansiveness and like spaciousness to what we're allowing ourselves to experience, and then what we're calling that experience. Because what we call that experience is going to help us share it with others and help us be able to recreate it or not. So, and then there's also some learning about like, what are the limitations of the actual voice mechanism? Everyone has different capacities for different things. So we can't all do the same things, and you don't always know what you can do until you try to find where those limits are, or try to find where those abilities are. So that group is very much like an example of taking the same kind of ideas around like your experience in your body and language and how you communicate about it and what it means for your relationship with other people, but in a totally different context.
So it seems like you have this this paradigm of expression in language that I don't know how much is unique to you and your way of, and your path as a SLP, and how much is sort of fundamental to speech language pathology. So I was curious if you could speak a little bit to what are SLPs, and then where are you in that in relation to that?
That's a really good question. So SLPs, speech language pathologists, can do a lot of different things, right? Like I mentioned, they can work with kids or anyone around speech sound production, language development. Language in and of itself has like all these different subcategories. There's people who work with people who stutter or have disfluencies. There's people who work in related to voice. Voice can be voice work can be as a result of some kind of event, like a stroke or some other kind of condition that happens, and it isn't like the person's baseline, or it can be because the things that we're talking about, their voice doesn't match who they are and they want to change that. There's SLPs who work in the hospitals and focus only on swallowing disorders. Let's see, Um, there are people who like hyper focus. So when I was talking about assistive technology, the like speechy term for that is AAC, which is augmentative and alternative communication. Um, and that is a sort of a niche area around supporting people whose speech doesn't serve them, essentially. They may speak, they may not speak. It could be from like a neurological event that has happened to them as an adult, like they have a like ALS or a stroke, or there's so many different things that can happen to people. Those are just two maybe that people are familiar with. But it could also be that developmentally they have delays in their speech development or language development. It could be that they are autistic or have Down syndrome. Sometimes people who are autistic and have Down syndrome, speech doesn't serve them as their communication modality. They're, like I'm only even probably getting like the tip of the iceberg. It's a very, very broad field. There are people who focus on social pragmatics exclusively in social communication, which is really that like communicating between people. There's literacy as an aspect of some SLP work. Um, there's so many things. So I think that I used to really be more, um, I don't know, worried in a sense that like somehow I was like straying outside of something that I'm supposed to be doing. But when you start to think about all the things that I could be doing, I feel like there's like, how can you stray?
I feel similarly when it comes to OT. Like I mean, come from this manual therapy background, and I'm looking at posture and ergonomics, and really wanting to put my hands on tissue and change its quality, and that's not what 99% of OTs are doing. And but the but when we get into what occupation is and what that is, it's like, I'd have to try really hard to go outside my scope. I mean, not too hard if I started getting into medications and such and making too many recommendations there, but that wouldn't be within my scope of practice. But it was like, as far as like if I'm meeting my clients' needs with the skills that I have, like it's a pretty broad umbrella. So in all the things you mentioned for speech language pathology, the one that I've actually witnessed the most working in a nursing home, but also seems to fit the least from the definition, is swallowing and feeding. Like, why is swallowing and eating part of language and language and speech?
I think because as it relates to like it's where sound is produced. It's the same like overlaid mechanisms of swallowing and sound production. Um, I'd have to think. I'm sure that there's some like historical reason about how those things got lumped together. Um,
But it's not really
but
a specialty of yours in any case. So
I've done some, like I've worked in settings. I've worked in nursing homes and hospitals a little bit, but I think that I didn't have a medical background at all when I went into speech therapy. And so I found it super intimidating. Um, and I've definitely done some work in those settings and feel more knowledgeable about it. But it's also sometimes you're working with people who are really medically fragile and it feels much more serious. And I think that was just too much intensity for me. I did a few years ago, I worked as a traveling speech therapist and in Colorado, and we went to Colorado for 4 or 5 months, and I worked in a hospital where I was doing outpatient and inpatient speech therapy. And a lot of the inpatient speech therapy was swallowing assessments to determine what kind of what texture foods would be safest for someone who was in, different sort of mm, uh, who, sometimes they were in pretty fragile medical states or recovering from something and it's a whole different world. It's just not the world for me.
no, I feel similarly about many aspects of the broad umbrella of occupational therapy. That I'm like, I'm glad there's people doing that, but I don't have to do all things.
Yeah, exactly. And I think it was a really great experience to have. Um, and it was something that was hard, just there aren't a lot of hospitals in Vermont, so it is hard to get that kind of hands-on experience as a student when you're doing like different kinds of clinical placements. But then also like if you don't get that experience as a student, it's hard to just kind of do it a little bit and feel confident in it. So it was a good opportunity for me to like live somewhere else and do something fun. But yeah, it's just not my um but I have friends who love that stuff. Like they really love the science, the different kind of science-ness of it and the medical aspect of it, and they depending on who you're working with, the types of patients you're working with, it can be really straightforward or really complicated. Sometimes I think there's also like SLPs I know who work with cancer patients who like sometimes it's around swallowing and voice simultaneously because some of the treatments, depending on what kind of cancer someone has and the treatments that they have, like can affect both of those things, voice production and swallowing. So it can be like a more involved kind of work that I have very little interest in doing.
So it seems like we talked a lot about what does interest you is the interception, the somatics, and the language expression. Sort of, it seems like there's an authenticity and a personal self-actualization.
Yeah, you said something. You were starting to say like paradigm of something. And what my brain was filling in there was play. Like, I think I work from a paradigm of play. And that, the more I've done in my own private practice, the more that is really becoming like the anchor. Because whether it's like play that you might picture for kids or play in terms of improv and for adults or somewhere anywhere in between, I think that that authenticity, that authentic connection that's required as a foundation for working around communication comes out the best when people feel like they can play in whatever that means for them. There's not like a universal definition of that, but that seems to be what is emerging lately.
Well, thank you so much for sharing all of this and delving into this conversation with me. I really appreciate your time.
Yeah, thank you. Thank you for being curious.
That was Leah Sophrin talking about interception, somatics, and language. If you enjoyed that conversation, keep tuning in because we will have an upcoming episode with Leah talking about a little bit more about transgender identity and gender roles in voice. You've been listening to Resilience Radio. The music is brought to you by Aaron Marcus with their tune Some Biological Process. You can check the show notes for full credits on that. Thank you for listening. Take care.